From never to always. Do you have someone you can talk to about your health? From no difficulty to unable, are you able to climb one flight of stairs or walk one block? On a scale of 0 to 10, what is the level of pain you are experiencing? 0 being no pain at all, and 10 being the worst pain you can imagine. We've all heard these kinds of questions before, most typically when we go to the doctor for an injury, illness, or just a simple checkup. These are typical questions from what are called patient-reported outcome measures, or PROMs for short. PROMs are tools that ask questions about people's health and quality of life. They usually contain several question and response scales that patients respond to and are used to gather information directly from patients about their physical, mental, emotional, and social health. Healthcare practitioners, administrators, policymakers, and researchers have been using tools like this for years due to their ability to provide important information about a patient's health and quality of life from the patient's perspective and better inform decisions for what matters to the individual. But the question is, are PROMs effective? As much as we'd like to apply a one-size-fits-all score for all people in the form of a standardized questionnaire asking about their health, it's really not as easy as it sounds, because everyone is different. Although there are a number of roadblocks that PROMs scoring methods face, there are two main complications that arise. The first is response shift, or how the patient is coping with their illness. Let's say a patient is undergoing a knee replacement, and before undergoing surgery, the patient was asked, "What is your perceived health level from 0 to 10?" And the patient answered, 6 out of 10. But then after the surgery, when asked again, the patient answers with a slightly higher 7 out of 10. This is understandable because the procedure has eased the problem. However, if we ask the same patient after surgery to think back to before their surgery and tell us how they now perceive their health back then, he or she might report a lower number than before. For example, 5 out of 10. This illustrates the problem of response shift. Response shift can take place after a surgery like this, or a traumatic event, or even when priorities and values change in one's life. For example, after overcoming an illness, a patient may value being close to their family more than their physical capabilities. Essentially, the patient before treatment is not the same as after. And if response shift isn't taken into account for the questionnaire, then it could mask the actual impact of an illness or a treatment for patients, even making it seem like the patient has a better quality of life after treatment than actually exists. The second complication is differential item functioning, which basically means different groups of people respond differently to the same questions. This sounds intuitive, but factors like culture, experiences, personal characteristics, and beliefs can affect someone's responses to questions about their health. In some cases, these factors can cause certain groups of people to consistently score higher or lower than others who have the same level of health. Take, for example, this question about mental well-being. In the past 7 days, how often have you felt down, depressed, or hopeless? With response options, not at all, several days, more than half the days, or nearly every day. Particular groups of patients may consistently respond not at all because they are not as comfortable as another group with expressing negative emotions. This group of patients will consistently have a more positive mental well-being score. Since the mental well-being of the patients in both groups is actually similar, this can lead to inaccurate conclusions by caregivers and other important decision makers. For example, one group may have depressive symptoms which will go untreated. Historically, we've assigned numbers to things such as weight and blood pressure and used these numbers to capture differences in health between patients or changes in health for a patient over time. But the patient's perspective and needs have often been overlooked. Human beings have factors such as emotional well-being, physical well-being, culture, and more that affect their responses to questions about their health. Sometimes, these factors can also introduce bias into the findings or lead to false conclusions that overlook the true overall well-being of an individual. In the end, there must be a change in how we look at health and the modes of gathering information on patients' health, as there is no one-size-fits-all for measuring what matters. Good news! Statistical methods can be applied to achieve tailored measurements for comparing patient-reported outcomes over time and between different people.